In 2023, Mulago National Referral Hospital marked a major breakthrough, successfully conducting its first ever kidney transplant. At the time, the life-saving procedure was performed by a joint team of Ugandan doctors and renal transplant specialists from India's Yoshida Hospital, offering new hope to patients who previously had to seek treatment abroad. For the inaugural beneficiary, Mark Chiemba, the surgery was more than a medical procedure. It was a second chance at life. Years of dependency on dialysis, mounting costs and uncertainty have given way to restored health and renewed independence.
My biggest challenges before the transplant were balancing academics with, with oath. It was the biggest challenge, I think. And then my lifestyle changed. So I wasn't expecting it. So it was such a big challenge in a way that even my daily routine changed. Because of dialysis, you could feel weak after the machine. It was quite expensive. But fortunately, during my pre-transplant process, I was able to be put on UPDF insurance, and I could access dialysis from Victoria Hospital and later in Bombo Military Hospital. So I'm grateful for the CDF, the president, because he was the chief initiator of the transplant.
Today, the hospital says the renal transplant program has steadily evolved, laying groundwork for more advanced specialized surgeries in the public health system. Leading the program at Mulago is Associate Professor Frank Asiimwe, who says the hospital has since strengthened clinical expertise, post-transplant care, and multidisciplinary coordination, critical pillars for the sustainability of transplant services.
Come 2027, we will be completely on our own. We'll be able to do them regularly as and when they arise. Also next year, we hope to bring on board liver transplant. Maybe we may do one, maybe two, we don't know. But we also want to thank Yoshida Hospital, which has partnered with us, also to kickstart the liver transplant program. We are glad that these years that we have existed as an independent nation, we're able to do things that independent countries do on their own. Instead of continuing to send our patients to India, to Turkey and other countries, we can do these surgeries ourselves, and we are very excited. It begins with good patient selection, okay? And because of this, our criteria is still a bit rigorous. Then good patient preparation. And I want to thank my nephrology team, both the physicians and the nurses, who select, who prepare, because these patients must be optimized. Now, you learn by talking to some of the patients who have dropped off the list. Some of them have dropped off even like the day before. They get an infection, they have some bit of, we call it sensitization, donor antibody sensitization. All these things, we pick them. And once we pick them, then we prevent catastrophe. So that is one part we have been homing. The next thing we've been homing is the actual surgery. As of July this year, when we did 4, the team which came from Manchester actually began observing us work. So July, the 3 that were done, 4, and October, the 3 that we did. So the last 7 cases, the Ugandan team was doing almost entirely on our own, with the visitors watching us. So that's another part, the actual transplant, the surgery, the anesthesia, the nursing care, the post-op nursing care. For instance, in October, we had one complication. We had a bit of a bleed. The team we had worked with had already returned, but we were able to take back the patient to theater, open them up, look at the kidney, look at where we had anastomosed, make sure everything was fine, closed him, and the patient returned home very safely. So we are homing all the skills of preparation, the surgery, picking up any complications, postoperative care, and home care.
According to the hospital, performing kidney transplants locally has significantly reduced costs for patients while building confidence in Uganda's capacity to handle complex medical procedures.
Government has been shouldering all this burden thus far, but this service cannot be a free service. The first nail in the coffin of any program is if you make it a free service, because government money is like rain. During the rainy season, it will come. During the dry season, it doesn't come. So it must be a paid-for service. Like patients have been mobilizing funds to go to India, to go to Turkey. They must mobilize funds to have these services delivered. Because we don't want to reach a day of surgery and we find that, oh, there is no cannula, there is no this drug from NMS, there is no this, no. We want the patients to mobilize the money, give it to us, and that's another tough question. Because when money is paid by patients into a government facility, it goes to the central pool and then it's supposed to come back. That is a problem. Because we have estimated this will cost between 40 and 50 million. So Asiimwe who needs a kidney, if they mobilize their 40 million and they bring it to Mulago Hospital, we need to be sure that that 40 million is there to buy whatever Asiimwe needs for the transplant. Not that the money has gone to the central pool and they're waiting for a release. Yeah. That's going to be a tough ask. They will need to change some of their policies of the pooled services. We need some bit of autonomy.
Health experts say lessons from the renal transplant journey will be vital, particularly in financing, staffing, and long-term patient follow-up. For patients like Chiemba, the success of the program is already clear and serves as proof that specialized care can be delivered within Uganda's public health system. Mwesigye, NTV.